Hey everyone, and thanks for dialing in today. Welcome to ReThink OT Dailies, 5-minute messages to renew the OT mindset and reignite your passion for the profession. I'm Michelle Eliason, and I'm a neurocentric occupational therapist and the creator of geriatricoccupationaltherapy.com. Let's jump in. Today's topic is building a treatment session according to the OTPF. If you've forgotten what the OTPF stands for, it's the Occupational Therapy Practice Framework. Hang in there with me, guys, because we are going to move in this call. Anyone who knows me knows about my passion for the OT Practice Framework, probably from my personal experience of being completely lost when asked to use my full scope of practice. The OTPF has become a guiding post for me in everything I do as a clinician. So what are the 3 points we are hitting today? Number 1, what does the OTPF say? Number 2, what does that information mean for you as a clinician? And number 3, what is the rule of thumb to follow during every treatment session? Number 1, what does the OTPF say about a treatment session? It must be relevant. An occupation are the things that people do that occupy their time and attention, meaningful, purposeful activity. The personal activities that individuals choose or need to engage in and the ways in which each individual experiences them. The bottom line, be careful not to choose your occupation-based activities for your patient. I read several articles regarding occupation-based treatments and their lack of success due to client factors. Patients didn't buy into them. They didn't understand why it was more beneficial for them to practice an unsuccessful activity repeatedly and how that was in any way skilled. Because of that, they had poor outcomes and just got through occupation-based rehab so that they could do a more effective therapy. Ouch. Remember to ensure that your client understands the skill and relevance of the activity you are telling them to complete. It doesn't matter what you feel the benefits are if they are interested. Sometimes occupation is exercise. Remember that. Meet your patient where they are at. Second, needs to be based on research. During the intervention process, information from the evaluation is integrated with theory, practice models, frames of reference, and evidence. Straight from the OTPF, guys, aka show your competence. Ensure that what you are doing aligns with actual foundation. And then now that we know that information about occupation-based interventions, we know to tread lightly in occupation-based treatment, while still remaining true to our core when it says in the OTPF that you should use your knowledge of the transactional relationship among the person, his engagement in valuable occupations, and his context to design occupation-based intervention plans. Lastly, build in reflection. Emotional regulation capacities can affect a client's ability to effectively respond to the demands of occupation with a range of emotions. It is important to remember that many body functions underlie each performance skill. Second, intervention is provided to assist clients in reaching a state of physical, mental, and social well-being. Identifying and realizing aspirations, satisfying needs, and changing or coping with the environment. What does this mean? It means include reflection. Occupational therapy is not strictly physical or strictly mental, but it has many elements and clearly demonstrates the importance of them on a mind-body-spirit connection. The reflective process is how we maintain a collaborative approach. Feelings are important. Number 2, what does that information mean for you as a clinician? In short, it means to keep your notes out. Keep researching. Be an active listener during every treatment. And take time to digest and modify your approach if necessary after every reflective statement offered by your patient. And then number 3, what is the rule of thumb during every treatment session? Remember the 3 R's. Relevant, research-driven, reflection. Relevant, is your treatment relevant to the client? Research, is your treatment session based on some type of actual knowledge, theory, evidence, or model? And then finally, reflection. Take time to allow your patient to reflect on what is working and what is not working. I hope that provided some clarity. As always, head to our website for a transcript of today's call. That's all for today. Thanks for listening. For more information, check out geriatricoccupationaltherapy.com. Talk to you tomorrow.